any opening remarks? If not, you can introduce your team to members.
Thank you very much, Mr. Chairman. Members, good morning. We have no opening remarks good afternoon, sorry. We have no opening remarks per se, but the team from the Ministry of Health and Wellness, our Chief Medical Officer, Dr. Jacqueline Bisesa McKenzie. We have our Principal Financial Officer, Mr. Donovan Davis, our Director of Policy and Planning, Mr. Howard Lynch, and our Director, Health Systems Planning and Integration, Dr. Nadine Williams, and we have from our epidemiological unit, Dr. Wellington. So that is a composite of our team to provide information as is required based on the supplementary estimate that has been tabled.
Members, I'll open the floor for questions on this supplementary estimate. All right, let me start off. I see your COVID response of an additional $1 billion. First, how much have the ministry so far spent on the COVID response? And second, will this carry you through for the rest of the financial year, or what is expected that it is that the ministry will need for an expenditure going forward, for at least for what it is that you have seen so far that will carry you through for the rest of the financial year?
Thank you very much, Chairman. So from the beginning of the financial year, we have been supported significantly through the consolidated fund. To date, we have received $7.6 billion for the allocation for fiscal year 2021. And of this amount, approximately $6.1 billion has been disbursed across the different objects on the budget. The major area of expenditure include our expenditure on drugs and equipment and our expenditure on accommodation. And this was primarily due to the arrangements that were made for the returning residents and the operation for the controlled re-entry program. The other area of significant expenditure relates to the salaries that we have had to provide in terms of the additional staff that has been employed by the Ministry of Health in terms of its response, and also our expenditure relating to the additional work.
But would that come out of this additional amount for the COVID response?
So no, that is the amount that has been spent to date. The additional COVID response allocation that we have received of $1.065 billion, that additional is in the first instance for the compensation. $550 million is for the compensation, and that is specifically for the additional doctors that have been employed, the 121 doctors that have been employed, the approximately 1,400 community health aides that are being employed, of which we have already concluded the contracting for approximately 850, and so we have an additional 550 to be engaged, and that recruitment process is ongoing. We have an additional $177 million that has been provided for this year to deal with our current arrangements with El Greco and Melea, where we have secured those facilities for what we call our for our isolation facilities for persons who would be in communities that are at risk, and we need to extract them from communities to prevent.
Is that a current arrangement now?
Yes, we have current arrangements with El Greco and Milea that we intend to continue. Because as we go through community transmission, there are going to be instances where we have vulnerable communities that are high density communities, yes, or communities that have high population of at-risk persons. Those are the elderly, persons with comorbidities, etc. That if they remain in the community, they have greater exposure and greater risk, and as you know, their outcomes are significantly worse than persons without these underlying conditions.
And you're budgeting 177 million
based
for that outfit, for that
arrangement,
yes,
to the end of the financial year.
Okay, and those are the Braco.
That's Melia Braco,
yeah,
and El Greco.
And El Greco. Okay. All right.
And then we have an additional $252 million that we are utilizing for all of the other support arrangements that we have ongoing for our COVID response.
So you really don't have anything left out of this 1.065 billion then?
No, that is just for the other 300 that we received in this, or that is being proposed in the supplementary estimate, is for our technical services division. Now, the ministry, as you may recall, initiated a program in fiscal year 1920 for the outsourcing of diagnostics for patients in hospitals. And we are, this 300 million here is to provide for the continuation of those services. Because what we are finding is that because persons are unable to afford CT scans, MRI scans, they spend longer time in the hospital, therefore longer time on a bed, therefore our turnover rate in the hospital becomes challenged, therefore we are unable to manage more efficiently our crowding factors in terms of what they call it now? Overcrowding, there's the word. The overcrowding in our facilities.
But to this additional 75 million to deal with delivery of health services, I mean, after being budgeted 46 and seeing the increase in patient load now, is this amount adequate enough to carry you through?
So this amount is for the arrears, some arrears payments that we have to be paid for medical consultants and the public health inspectors. So this is additional on the 21 for the compensation for this.
This
300 million?
75 on 42,002.
On the
delivery of health services.
10919, activity 10919.
Okay. So this is outstanding amounts then?
Yes, these are arrears that we are.
So the ministry is managing with the additional load in this wave of the pandemic.
We have to. We don't have a choice. We are mindful. One of the things that we are mindful of in the Ministry of Health is that every dollar given to us is a dollar taken from somewhere else. And we are conscious of the fact that in terms of our priority nature, we do have a significant fiscal footprint. And therefore, we have to consolidate our needs based on the existing pie. We would like to do more. We are challenged to do more, but we also have to be cognizant of the overall capacity.
Mr. Bryan, we understand that, but even for us at the committee level. If you get it wrong, then we have another problem out there.
Sure.
So, you know, I mean, you don't have to be diplomatic in your answer. Yeah? Because if it is that the ministry needs more, and I know the FS is here, and she's hearing you herself, right? But if you if you don't get it right, then we have a problem. So that's why my question, with this $75 million, which is for ARERAs, is the ministry in need of additional resources? This $46 billion that you have gotten at the, well, up to the first supplementary budget, is the ministry able to manage in its delivery of health service efficiently and effectively, seeing that we have seen a large amount of persons tending to the hospitals? Yeah?
So, Chairman, the health system over many moons has always had a deficiency in the allocation of resources. At this point in time, I don't have any MRI machines in my ministry. I have, I think, two working CT scans in the ministry. So the need for additional resources at all times is it needs no debate. The Ministry of Health and Wellness can always utilize additional resources to do more things. But the reality, we are a part of a whole. And the provisions that we have here is out of a negotiation. And it would be, while I can articulate ad nauseum around the needs of health, we are part of a team. And the presentation here is out of a negotiation from a team. And so, yes, the health system requires more. At this time, these are the considerations that are for us.
And you see, just in the instance where you mentioned about, you know, partnering with hotels in taking persons out of, putting them in isolation, but then you hear reports of hospitals that are just overloaded, no bed space. So in a period like this with the pandemic, what are the short-term measures being put in place? Do you need additional resources for those short-term measures, that we don't get the complaints that persons, you know, coming to the hospital and have to sit down on a bench for 2 days, or there's no bed, you send them home, and because there's no bed space. So similar to how you were looking at that, the arena, for instance, or in Mandeville or Black River, where there's a shortage of bed space. Are there any other accommodation that can be used, or, you know, short term and short fix? That is what I am talking about. And I know that there's a greater need for resources.
Yeah.
But as it is now, in the crisis that we are in, can we do a little more to ease the loads on the hospitals? Or can we put a little more resources in the health centers than to take off some of the loads off of the type B or type A hospitals? You know, things like that. You know, so what are the plans in this instance, since then you get the call and the SMO get the calls that there are no beds in Mandeville and people have to now sit down inside of the corridors on benches?
Thank you, Chairman. And I hear you, and I understand the position that you're taking. But truth be told, most of the quick wins and short-term actions that we have taken, that are to be taken, are already being taken or are in train. Where we are now is our medium and long-term actions that, because of procurement, because of the market system for HR, will take a lot of time. So it wouldn't be useful to crowd out a budget space now when we know. So for example, we want to hire additional public health inspectors. because in the context of the preventative mechanisms that we need to become more active in the space in terms of monitoring of these spaces. But when you look in the market for public health inspectors, you wouldn't be able to, so we're looking to hire at least 241 public health inspectors. But when you look in the market for public health inspectors, there's not 241 public health inspectors waiting to be employed. But that is the need that we have in health, 241. So when we look to see what is happening at UTech, that generates, we won't have another graduating class of public health inspectors until next year. So to accommodate the salaries for the full gamut of need that we have, it wouldn't be reasonable for us to put that in this budget. But we will be making the argument for next year's budget. Right now, for example, we went to market for ventilators, for example. Although we went to market for ventilators in February, we are only now getting those ventilators because of the global shortage of these resources. Even hospital beds, there's a global shortage for these things. So when we factor all of those into consideration to accommodate in this fiscal year activities that, based on their trajectory for delivery and based on the cash flow projections on them, we would not be able to do that in this fiscal year anyway. It wouldn't be reasonable for us to accommodate that within this fiscal program. What we have to do is to plan. And the Ministry of Finance is going to have a hard time with us next fiscal year because we'll be putting into place all of these plans so that we are ready to disburse in first or second quarter next fiscal year.
My comments really had to do with the emergency that we're in.
Okay.
Member Jackson, you, and then Member Hannah.
To the whole testing capacity. You had indicated that 75 million was for the arrears, but on page 42,001, 10663, you have $300 million more noted for additional requirement to facilitate continued outsourcing of diagnostic services. Could you elaborate on what those additional capacities are? And secondly, while answering, what extent of additional testing will be taking place? We know that there is a correlation between the negative or positive, depend on the level of testing. If your testing is down, your results are going to be down. So could you give us some?
So luckily I brought the CMO. She'll take the testing question for me because that's out of my pay scale. The other question, though, on the 300, do you want, Chairman, for me to take that question, or you want me to? I see Member Anna. Okay. All right. So as I said before, in fiscal year 1920, the policy position was taken that given the issues relating to diagnostics in hospitals, your X-rays, your MRIs, your CTs, your angiograms, all of the, and the like, that it was impacting on the length of stay in hospitals, where persons would be in hospital, on the bed, need a CT scan, some diagnostic, and they are being told, well, you know, you're going to have to go to some private entity to get this diagnostic. And then the patient would be on the bed calling mother, calling father, auntie, uncle to pull the money together. And members of parliament to get these resources to pay for the scan. The time it takes to get the resources and then mobilize and then go to the private practitioner and then come back would be a week or so. And so what we have decided to do is to form PPP arrangements with private providers of these services. And then these persons would be directed to these services directly by the hospital.
When they are so directed to these private providers, are they charged those outside commercial rates?
No, there was a concessionary rate that was determined by the government.
No, concessionary rates that are paid by the patient or by the ministry?
By the ministry.
Okay.
They're paid by the ministry.
Okay. Right.
So it removes that need for persons to identify those services.
Okay. Member Holness.
I needed to put on my glasses, but just a general question arising from just listening to some of the reports in the media, and this may be the CMO. When you have some of the debts that you call conditional, is that the terminology you're using?
Coincidental debt.
Coincidental, sorry, that was the word. I am a little bit confused because I was wondering if those persons died from something other than COVID while they were being singled out, like probably gunshot wound or from an accident, and they were found to still have COVID. I think that terminology may be confusing a lot of us.
Okay, I'll ask the CMO to address both the question on testing and this question, and to provide this clarification on coincidental death.
Right. Good morning, or afternoon, everyone. I wasn't really clear as to, were you asking what is the projections for testing?
In part, what I wanted to get a sense of, I would know we're testing more, right? And by extension, if the provisions are in the budget for more testing. One of the things that challenged my mind is that the capacity, I remember the Minister of Health in the last Parliament had indicated that the testing capacity had gone up to something like about 3,000 per day, thereabout. But the actual level of testing that were taking place on a daily basis was significantly less than that. So whatever the reasons were why our testing levels were that low relative to our capacity, if it is resource, what in this rest of this financial year is it that we'll be doing more testing, given that we have the capacity to do as much as he had indicated?
Right. So the resources for testing come from several different areas, and we are heavily supported in terms of the reagents from PAHO WHO. We are also supported through the CDC grants as well for testing, and we have been supported through the IAEA, the South Korean government, several different entities that would have provided the resources. In terms of the routine, recurrent things that we provide, those would have been budgeted for, and so would form part of our recurrent budget. And of course, there would have been some allocation for an increase. In addition, the antigen testing that we're doing is also heavily supported by PAHO WHO. The almost 100,000 test kits that we're supposed to be receiving this month are coming from PAHO WHO. We would have looked, though, at in terms of what happens after those are finished. And so we are in the process of getting information from PAHO WHO. If we are to source on our own, what would the cost be? And then how it is that we plan for that. So we would have made some allowances in terms of, because we do see those things on the horizon in terms of additional costs that there would be in terms of testing. In terms of the coincidental deaths, what happens is that in terms of our general hospital surveillance, we require that all persons that come in that are critically ill be tested. So if you come in for something else, you're going to be tested. If you're an ICU patient, or you come in with a stroke or something, you'll be tested. So we would therefore, considering now that we have a considerable amount of local transmission, there would be a lot of persons who would be walking around that would be COVID positive. So they would end up in hospital for something else. So they didn't come in because they were having fever, shortness of breath, they weren't having any cough, they weren't having any respiratory symptoms. They wouldn't have had other symptoms that would have made them a suspected case, and then they would be tested and become a confirmed case. They came in because they had a stroke, they came in because they had a heart attack, but they would have been tested. So that pathology that they presented with resulted in their death, but coincidentally, they were found to be positive with COVID.
CMO, thank you very much for that. I was hoping that no one would presume that we're using that terminology to hide some of the persons who had COVID, but passed. It was becoming a little confusing when persons asked what was coincidental COVID death. So do we still record them as a COVID death? Yes. Want to
We
make that
still
clear?
record them in our confirmed numbers of cases.
Dying or only cases?
We record them as cases, but we don't record them as COVID deaths.
Okay.
We record them as coincidental deaths.
All right.
Because, you know, just to say that people die from a lot of things. And, you know, if it is, now that we are in community transmission, we have a lot of persons who are going to be positive. But we would be fooling ourselves and looking at our statistics differently if we didn't realize that people were still dying from heart attacks, strokes, and cardiovascular diseases, because then our planning, that would change our entire planning. We would no longer be planning for those things. So we have to be careful how it is that we say those things.
Thank you, CMO. That was absolutely necessary for the rest of our population.
Clarification on that.
Sure.
Follow-up.
Sure. Go ahead.
Right. Just for my own clarification, Dr. McKenzie, my understanding is that persons with underlying illness like, you know, heart conditions and so on, the COVID infliction will cause complications for such persons, which in turn cause the likelihood of death to be much greater. Where the COVID is a sort of catalyst that caused that death, is it classified as a COVID death or a heart attack?
You're asking a question that I'm sure we'd all be able to answer. We'd love to be able to answer that, because where does the COVID start and the other pathology take over? Or where does the other pathology end and the COVID start to take over? That is a question that's still out there. We're never going to be able to classify persons precisely, because there's so much that we're still learning about COVID, in terms that persons would have, there is a possibility that persons develop problems even after they've gotten over COVID, but there may be changes that would have occurred that would have made them respond differently in the future because of COVID. The debate is still out. There are so many things that are being published now to say what COVID will cause after you have been treated and recovered. You know, it's similar to effects of chikungunya and Zika after. So those discussions are still being had, you know, whether or not it is the patient has presented with a heart attack, but was there something because they had COVID that caused it to happen? I don't think we can ever be precise, but the fact is that if a person has the factors that would cause them to have a heart attack, and they end up having a heart attack, it is more likely that the heart attack would have caused their death. But you're asking for a preciseness in science that we're not going to be able to give you. I can tell you that it's a lot of discussion. It's not taken lightly when we classify these deaths. It's a lot of discussion and a lot of things are considered. Sometimes it takes long to get them classified because we have to ensure we get all the notes. We have to go back and interview the persons that are involved to get all the information. So you may see 2, 3, 4 days we have undetermined deaths. because we have to ensure that we look at the information, we dissect it properly before we come to a conclusion. It's not done lightly. It is done in an effort for that there is always clarity and there is transparency. And even after this set of review, we go back, just like with dengue. We would have classified, and then we have review panels, and we go back and we look again and see, was this the cause of death? Could something else have contributed? Was there something that we missed? So it's a process that there can never be any precise, not at this time. So much more that is still to be learned.
All right, on the capital expenditure, another further cut to the budget to redevelopment of the Cornwall Regional Hospital.
There was one other last thing I wanted to, probably more appropriately to the CMO. The Minister of Health at the last sitting of Parliament underscored, it has been raised before, but he has underscored the growing challenge or prevalence of mental health coming out of the COVID experience. I looked at the budget for allocation for Bellevue to see if there was any change in recognition of any greater or projected increase in need for support services there. So my overarching question is, in light of that recognition, many of us in our own lives see the apprehension among persons and by extension the mental, and just to clarify, mental illness doesn't mean because you're gone mad, but the other stresses and challenges that person face in those circumstances. So my question is there any provision either for outpatient services, contracting out services, but to the extent that this has become dominant in the pandemic, what provisions, if any, or increased provisions for that reality?
Thank you, Member. So the program for mental health is separated into three parts. It's the services that are provided by Bellevue for the treatment program at Bellevue. Then you have the program that is in the regions at the primary care level, and then you have the program that is at the in the hospitals. A lot of the hospitals do have mental health services that they provide. Bellevue is the final step in the whole metric of how we provide services for mental health. The overall program for mental health is provided in policy and, of course, operational in the regions. At the policy level, there are several things that are occurring right now to address the changing needs of mental health given COVID. So we are seeing where the impact of mental health on the elderly because of isolation issues, because of issues of anxiety, because their population, they're seeing the numbers and they're seeing the deaths, and there's a lot of anxiety that has resulted from that. And that in and of itself is creating some mental health issues. We also have seen how isolation and the fact that they don't have those interactions, those coping mechanisms for interactions have begun to impact on them. And so the program that deals with that level is, we don't want to preempt the minister. He announced in Parliament yesterday that that program will be implemented over the next 6 months to a year. And that is being supported by a $20 million allocation in the current budget that we have for implementation for COVID. That program will see the engagement of community actors and working with PAHO, WHO, and Red Cross to provide training to community actors to do what they call micro-interventions for mental health. to alleviate some of these stressors that are being impacted. But more importantly, this program has a referral mechanism. So when the persons at the community level engage with the elderly and other persons who are having any sort of mental health, negative mental health outcome, they're able to refer up. And it refers all the way through the different systems in the public health apparatus.
Community mental health cadre of workers. How different will what the minister be announcing is that from that set of health workers?
So what the spread and reach of the mental health aids in the community wouldn't be sufficient to treat with the broad area of concerns that we are now seeing re-COVID. So what it is that we have to have a sort of collaboration, public-private partnership, where some of these anxieties, some of these fears, and some of these mental health issues can be treated at the community level with these community actors engaging. But then when the cases become more complex, or they think that there's a need for greater intervention, it is referred up to the mental health officers within the public health system. And then it is referred to where the services can be provided to treat with the issue.
At the regional level?
At the regional level and straight into the hospital or Bellevue if required.
Mr. Brand, original question on the redevelopment of Cornwall and the estimated time for completion now. I'm sure with the reduction in the budget.
The short answer to your question, sorry.
Yeah, go ahead.
The short answer to your question, Chairman, is COVID.
Is?
COVID. So a lot of the activities that were planned for Cornwall this fiscal year, because of the delays that occurred on the project, because work had to stop at the hospital at a particular point in time, redeployment of resources, etc., we were not able to conclude on a lot of the expenditure that was anticipated to be done on this project. And so we had to acquiesce to the request from the ministry to reduce these allocations
So
for Cornwall, because based on the analysis, we recognize that we would not be able to disburse. We would not be able to disburse in time. Yes, correct. This was my previous boss in a session.
And your estimated time for completion, if work has started back?
Yes, the work has started back. The work has started back, and we separated Cornwall into 3 main phases. Phase 1 is now complete. That is the repair of the roof, because what was based on the analysis, the building suffered from a wet building syndrome, and so the roof repair was critical. So that roof repair is now complete. Phase 2 was separated into Phase 2A and Phase 2B. And Phase 2A was the complete gutting of the building. Now, because of the toxic material that is coming out of the building because of the mold, that whole operation was a technical operation. And then Phase 2B was the technical rehabilitation of the infrastructure. Because when we gutted the building, and we began to take out some of the component parts, we saw that the beams had rotted. We saw that a lot of the internal infrastructure in the building was either collapsing or compromised, and therefore you couldn't rehabilitate the building without addressing those issues. Phase 2B has proven to be the most expensive phase of the project, because every time we pull down something, there's something new. If it's not asbestos, it is the scouring of the beams, it's the scalding, they call it. Yeah. It's just a myriad of different issues that are affecting, and then we have already started the process now of contracting for phase 3, which is the complete rehabilitation, which is an international tender that will be launched.
So, percentage-wise, where are we in the project itself?
If we are to do a percentage calculation, we are complete. That's 100% on phase 1. On 2A, we are 90%. On 2B, we are about 40%. And then we are still in procurement for phase 3.
You're telling me, I'm talking about the overall. Because I don't know what phase 3 may be 50% of the overall.
No, so that's a challenge in project management, because I can't just add and aggregate or average.
So when you're done with phase 3, you're finished with the whole project?
So phase 3 includes the rehabilitation, the furniture, the equipment, and everything.
Okay. All right. Thank you. Any further questions for the Ministry of Health? If not, let me thank you both.
All right. Thank you very much.
And we'll move to Ministry of Education.
Go ahead, sir.
Yeah, sure.
Okay, good afternoon, Chairman and members of the PAAC, as well as our colleagues from the Ministry of Finance and the Public Service. The Ministry of Education, Youth and Information budget, supplementary initial budget, approved estimates was approximately $111 billion as represented there. There has been an addition of $1.1 billion, as would have stated, and also a reduction of $1.254 billion, which has been transferred to the Ministry of Labor and Social Security to facilitate the payment of parents for our students who are on the PATH program. So overall, this would see the budget now being reduced by just $114 million, and so it now stands at $111,640 million. I have with me this morning our Principal Financial Officer, Mrs. Sonia Banton, and Mrs. Philippa Grant-Smith, who is our Director of Projects.
Thank you. Members, open the floor for questions. Madam Pierce, there's $1 billion for information and communication technology services.
Yes.
Is that for the tablets?
That is for the procurement of tablets and laptops for our students on the PATH program.
On the PATH, all right. So originally there was $112 million that was approved. Is this $1 billion for the tablets that you are delivering now, or are these for new tablets?
So the $1 billion will form a part of the overall amount that we had projected for the procurement of tablets and laptops during this financial year, sir.
Yes, but how much of this you're delivering now? What, 36,000 tablets?
Okay, so based on the figures that we have detailed, we will be providing a total of 81,000 tablets to our students on PATH, 40,000 of those have already been procured by eLearning Jamaica, and the distribution has started. And the other 41,000 will be also, the procurement will be supported by eLearning, but those funds will be from the ministry's budget.
Chairman, may I add something? Because Chairman keeps asking a question that I don't think we're getting the response to.
Which is what I was just going to ask.
If you look at the figures, if you look at what was the original approved budget, and then you go to the end to revise estimate, you see very little difference. So Chairman is asking, with less than $100 million addition in the overall estimated spend, what is the variation in this tablets in school program?
No, it is $1 billion difference from the original estimate. So the question I'm asking, this 40,000 tablets that you're distributing now,
Right, yes, sir.
will part of this $1 billion that you're getting,
No.
or this $1 billion will be for an additional
That will
40,000
be
tablets?
for an additional 41,000 tablets that will be procured.
Yeah. And you said a procurement. How long did the first procurement take you?
So we have started the procurement process. We have taken different approaches, and I'll try to explain based on our discussion with eLearning Jamaica, of course, that is responsible for education technology. The first approach was to, in consultation with our high schools principals, to ask them to assist us in the procurement of the laptops for grades 10 to 13. Since we have made that decision, we, through service level agreement, provided 50% of the funds through the usual grants and medium that we use to support our schools. Since then, we had a meeting with them and the e-learning company. eLearning Jamaica has been able to secure some group discounts as it relates to what they will be procuring. And so eLearning is now working with these schools to ensure that they get the group discounts, economies of scale in terms of the procurement of these laptops for our students. So that was the first approach that we took. Now, based on all that has happened over the last 2 months, I would say, because we did this from early August, some schools have expressed challenge in terms of the procurement, and so we are now working through e-learning to ensure that e-learning can do the direct procuring for those schools that are having difficulties.
But why not then have e-learning, since they were the ones who procured the first set of tablets? Why go to the principals and not just do it through e-learning?
So what we did initially, Chairman, we had a consultation with the principals, because the truth be told, because of this pandemic it has been a moving target. And so we are trying to see if we can find the most efficient way of ensuring that the tablets and laptops can be in the hands of our students. We have sent grants in the past to schools for the procurement of different materials, including computers. So it really only needed consultation with our principals and our board chairs to ensure that this is done.
But in this instance, when there's a shortage of tablets with the specs that is needed for online learning, asking the principals to go out there to go seek it, and now you're saying that the Ministry of Technology is now intervening with universal access to source them, to assist in the sourcing. Why then give the money to the schools, and why not then, since that is the mandate of the fund itself, not have them just source them? I mean, it is like putting the cart before the horse, when principals ought to be spending time in getting school ready. for what you have asked them to do and what is expected of them, to now go out there shop by shop to go find a dozen or 2 dozen tablets, which there is a shortage, worldwide shortage. There's no question about that.
So, Chairman, the principals were not left on their own in terms of the procurement. We met with the suppliers who are on the NCC listing. We had discussion with them in terms of this procurement that is currently being done. We gave them guidance in terms of following the procurement rules, and we had e-learning Jamaica on board from day one to support the institutions in the procurement of the tablets. We took this decision in early August because we realized that we were getting closer to September. At that time, we were to start opening of school on the 7th of September. And so we had to procure for the grades 10 and 11. We only had 40,000 tablets that were already procured for the primary level. And so we felt that using a collaborative approach that will still ensure that we get the economies of scale with e-learning would have facilitated us. And some of our schools have really gone ahead and have done their procurement, and the tablets will the laptops will be provided in short order. But we are managing the situation carefully to make sure that at the end of the day, the schools and our students are supported.
I am sure. Just, I would see more sense that if you're going to do another round like that, that at least allow the entity within government that specializes in that to do the procurement and leave the principals in managing the schools. Yeah? Because many a times we take them away from managing the schools in doing things that they actually should not be doing. Right? But I asked a question earlier. How long did it take for the first procurement activity to go through, before the procurement to receiving to distribution?
You're talking about the e-learning
The first
procurement?
40,000 tablets.
Okay, that was done by e-learning, sir, so I don't have the precise timeline, but I believe they started the process in March of this year. And the first set of tablets, I believe, the delivery, the procurement was completed, and the delivery period, somewhere in mid-July, they started receiving the tablets.
They were here in August. You had them in storage from August. So how far you reach with this second set? Because if it takes so long, by the time the school year finishes, when you're just getting them?
So, Chairman, we have asked e-learning to do the procurement of the additional tablets. They are now, I believe, at the Public Procurement Commission for their approval, after which I believe they will do the documents to be submitted to Cabinet. So e-learning is actually handling that aspect of the procurement, sir.
So we're going right back through the procurement process again with this, most likely the same suppliers. So isn't there? See, I mean, I hear all of this, Madam FSAD thing, but this is an emergency. And I've seen over and over in this committee where things come and you see expenditures which are deemed emergency procurement that don't go through a whole heap of this rigmarole. And I'm just wondering, if you're not happy with one of the suppliers in the first instance, then I can understand you saying that supplier is not in the list of companies. But can't we do this as an emergency procurement? Because if we go through the rigmarole, it's going to take 6 months to get here.
All right, sir, so I don't know the details of what they are doing, but certainly
your mask so that they can answer.
Certainly there is the follow-on provision, which could be utilized, as you say, or emergency provision, if we were satisfied with the previous supplier.
I have a question that may help to take us down this path. So from my simplistic accounting knowledge and background, I want to go down this road because it may not only help the government with procurement, but even private citizens. My first question is, how much does the ministry pay on average for one of the tablets that you consider to be adequate and meeting the specification? That is good for the public generally, because we have found that the tablets price move immediately from 10,000 to 15,000 the moment the ministry said that we are going to be at home and we need to have our children equipped with tablets or laptops. The prices started to skyrocket. I think this would help as well in going down the road of emergency procurement so that we are not compelled to use one single supplier, two single suppliers. If as a government we said, look, this is the type of tablet we're buying, we are paying $15,000 per tablet. All of you who supply tablets across Jamaica, if you can get them of this specification, get them. And parents would therefore be able to go out and buy at that price, and the ministry would be able to buy at that price.
So, if I may respond first to what FS said about the follow-on contract, that is what e-learning is currently doing, FS, but I suppose it still has to go through that process, which is far advanced, and we will be guided by them. Member Holness, we experienced that same issue. In July, there were tablets based on our specifications that we could get for approximately $20,000 and a laptop for about 40,000. By the time we did our small market survey in late August, we were seeing the tablets based on our specifications for $27,000. And the laptops for $54,000. So what we did, these are the prices that we project based on the amount of money that we have. But I should also say that based on volume discounts and the relationship that we have with, say, Microsoft, for example, they have a program where, because we use the Microsoft suite, including Teams, they will give discounts on selected brands up to $50,000. So we have provided that information to e-learning, and they are now processing to ensure that those economies of scale can be gained through the discounts. And I have also been informed that there are also other suppliers who will also be able to provide some significant discounts. So e-learning has proven to really be very valuable in really assisting the ministry at this time so we can focus on the technical areas relating to the curriculum.
My next question, and though we're not dealing with the Ministry of Labor and Social Security, I would ask PS President, I know she's there, so I'm asking PS President to just listen to this question. I'm still struggling to have an appreciation for the total number of children that we have in the system between primary school and high school. And when we take out those that will get tablets or computers through PATH, and then the additional ones that we will give a supplement, are we in any way able to determine how many other children have their tablets privately anyways? And why I've asked PS President to listen in, is the most efficient way to identify the needs of our children one where we just go by school and identify by individual child, or is it more efficient for us through the Ministry of Labor to also add an element of having every family with a child in PATH document all the other children in that family, the school that they attend, and the position that they're in. Either they don't have a tablet, they don't have another mechanism. Because I'm thinking if we need to shortcut ensuring that there is at least one single tablet in every household that has electricity, that hopefully has a parent that can read, we would be at a place that we can say, okay, we know that though everybody may not be able to be on this tablet at the same time, if the learning programs are taped, if the parents find a way to be able to go back One child can go on for 2 or 3 hours from 7 to 10, another child goes on from 11 to 1, another child goes on from 2 to 5, until my 4 or my 5 children in the household have gone through their work program for the day. I think we really need to think about it deeply, because if we're not careful, after a year, we are going to end up with children who are 2 years behind in terms of their education. So I know that the technocrats would have had far more of an opportunity to think through this than I would, but I'm asking the question because I'm not so sure how far we have reached in the program of registering every child. It was an excellent program. So when you got to grade 2, everybody was registered. Grade 3, everybody. Grade 4, I'm not sure how much of our children between primary school to the end of high school would have been registered that way. And if there is any mechanism within government to correlate families and have an appreciation of how many children within a household can be grouped together for services.
So, Member Holness, I will attempt to just indicate what the ministry has currently. As it relates to the total number of students that we have in the system, well, I don't have the breakdown here, but our figures from early childhood through to secondary is approximately 589,000 students. I say approximately because there are private schools that sometimes the information is not provided as is needed for us to have in the database, so the figure could be plus or minus. Now, with that figure, we currently have a national students registration system at the ministry with a unique identifier for each child, and that is what we use to process our examinations, the procurement of books, and other materials that each child has to benefit from. And each year we cross-check that data with our annual census data, which eGov is now doing for us, so it is being made electronic so that we can have real-time data. Now, the Ministry of Finance, not Ministry of Finance, Ministry of Labor, based on the figures that they have provided to us for the students on PATH, we have approximately 174,000. And let me just add that the early childhood cohort, which would be our basic schools and our infant schools, which are children who are in PATH families, we also ensure that they are captured in this figure as well, even though it is treated a little differently by the Ministry of Labor and Social Security. So we have tried to work through, as it relates to what you have said about the having at least one instrument, let me call it that, per household. We know that there are parents with three children, some with 4, some with 5. And so based on our crude projection, we thought that if we provided at least 100,000 tablets in the first instance, this would create or fill a very large void in the system. However, we realized that we had to wait until when school has resumed, which is this week, where we have asked our principals to do the survey with their teachers in terms of the number of students who have instruments, because there are some PATH students who have been provided by instruments through their members of parliament, persons from overseas. So we have already commissioned that survey to get a full idea as to those students who already have instruments, so that there will be no duplication. What we have also done for the many sponsors that we have had so far, once they have provided us with tablets or laptops, and they specify who these are to be distributed to, we ensure that we have the names of the students, the grades, and the schools, and we send this information to the schools so the schools can verify that these students do not already have instruments, and they can keep this in their records, so when e-learning is distributing for the PATH students, they can make sure that there is no duplication. It is not soundproof. I may say, are 100% accurate at this time, but we are working towards that. But I take the point, and I will discuss with PS Risden, if we could actually get that information up front in terms of the number of PATH students per household, then it would allow us to be able to fine-tune a little better the information that we currently have.
Member Hamilton.
PS, through you, Chair, I am not sure of the comprehensive methodologies of delivery by schools of lessons, but is there any provision or thought being given to pre-recording of lessons to facilitate those households that don't have reliable internet, one, or two, may not have the required instruments then to facilitate all children within that household? Okay. Is there anything in the short term where we could do pre-recorded lessons that can be sent to the students and then they can download, and then after that they wouldn't really need internet to view the lesson for the day?
Right, yes, Member Hamilton. We discovered, based on our survey from very early, from about in April or thereabout, that there were 238 communities or schools where they really did not have any reliable access to the internet, and that was right across Jamaica. Based on that figure, we estimated that we needed to provide for those students printed copies of lessons, approximately 50,000 at each level, so 50,000 of each printed kit for different subject areas. So we have used that information to plan for the new school year, and so now our team has been printing, and the distribution will start next week, so those students can have the hard copy material, and they would have already been provided with their textbooks. Now, where the pre-recorded lessons are concerned, we currently have an arrangement with TVJ, where we do live lessons at least for 4 hours on television daily. These lessons are saved and recorded, and those now go to a one-spot media channel that they have also provided, and the students, based on the agreement, will be able to access once they have an instrument. But in addition to that, we also have Ready TV in collaboration with CVM, where we do lessons and we record. So can those pre-recordings then go through WhatsApp media? Right. So what we are now doing, we are packaging those lessons in different medium through WhatsApp, as you have said, because a lot of our teachers and their students have their WhatsApp groups, and we are also preparing memory sticks with the information. So if they have the available access, then those can be provided as well. So we are trying many different ways to make sure that they have the support. And we also have commissioned our guidance counselors and our social workers to do the roving in terms of the visiting of those homes with those children to ensure that they are being protected and at least some form of learning is taking place.
We appreciate the TVJ and the Ready TV initiative. Why I ask is because you have some persons who do not have access to those.
Right.
So yes, they still have to be as comprehensive as possible.
That, and remember, it's because that is why the printed materials is so important, and we do it on 2 sides. We are using companies with their logistics organization already in place to make sure that those go out. So for example, we are using the children's own, so the curriculum officers prepare for the primary schools and it's printed. Those will be out next week. We are also using YouthLink, and we are also talking to Observer for us to look at that arrangement. So we provide the material, they print and package, and they assist us with the distribution. And I must say that our teachers have been very, very active in ensuring that they are also providing that kind of support through printed materials to our children.
The reality, though, PS, is that there are a number of students now who do not have access to the printed materials. So I've gotten the complaints.
Okay, so member, this week was deemed as the orientation week. Many of the students went into the schools to pick up their books, and so we expect that the first set of printed materials will be available for them for next week, and we have a 2 weeks period within which we will have delivery and pick up of whatever work that they would have done, and that will continue throughout the term. So you would not have seen it for this week, but as of next week, the team will be out getting this done.
Yes, I'm not so sure in terms of WhatsApp, which is probably one of the best tools outside of having an instrument like a laptop or a tablet that would be used by particularly rural children. Almost everybody has a smartphone. One parent in the household will have a smartphone. And I'm thinking that we should be looking down the line in terms of the opportunities that this presents us. Are we looking at the option of master teachers, master classroom, so that the curriculum is set in such a way that we record the 50 lessons required for grade 1? And the ministry goes through those 50 lessons and ensure that it really covers everything that we need to know. It is taught in a way that really gets home to the child, and that is loaded and it's there permanently. So the child gets to go over if they need, they can go back to a lesson. And then we do the same for grade 2, 3, 4, 5, 6, all the way through high school, because it literally now gives us an opportunity to have one teacher provide that master class for the entire Jamaica, and you can go over and over and over again. The level of efficiency that we can get from using the technology, having found ourselves in this place, can propel us forward by years and years. And it makes it possible for a child to be able to review whenever they need to. So we need to use this as a stepping stone. It may not be possible in the first term to have everybody up to snuff, but if we take the approach to say at the beginning of the first term, we want to make sure that we have a program for every grade, that we have taped the first 12 lessons. And by the end of, we have taped the additional 15 or whatever. And if we do that, even post-COVID, we would be in a place where someone can take up the curriculum for grade 1, grade 2, grade 3, grade 4, and literally start going through with their child, and they're able to go over where it is necessary and get our children at first world status in terms of our education.
Member Holness, yes, I agree 100% with the suggestions that you have made. We have 40 master teachers, and we have already started the process in terms of getting the lessons done. Actually, our suggestion that we do the lessons based on concepts and not specifically on grade, but for concepts you do it from the simplest to the most complex. The reason we selected that to do first is because each child is registered at a school, and there's a teacher that is responsible for each subject or a grade, and so they go at different pace in terms of the grade. So I will discuss the grade with my team, but we have decided to start with the concepts, and the National Mathematics team has already started to write and to tape concepts lessons that will be placed on all the media that we have so that our students can access. But thank you very much for that, and I do agree that it is an opportunity in a crisis that will benefit the education system, because the students will get the best teacher presenting the concept, and as a result of that, it will make sure that standards are the same across the country.
Member Jackson.
Well, I have two specific questions, but on the latter one, Madam Pierce, I would thought that to the extent that we are preparing these lessons for students, we would be using the best of our tutors, our teachers in the presentation. I fully support what Member Holness indicated, but I took it for granted that that would be the norm, since it's a global presentation we're making, so we'd use the best that we have.
Chairman, while that is ideal, sir, the way the education system is currently structured, you have a board and principal who are responsible for a school, and they have different approaches in terms of how they organize the curriculum based on the guide. So it was, let me say, easier, for want of a better word, to have them accessing the Google learning management system and to coordinate with their teachers as to how they are delivering to each class, because they have to keep register, they have to make sure that all the students are being engaged through the different approaches. So, Member Jackson, it wasn't an approach that we could have taken on immediately, but it is an approach through consultation and having the concepts organized in that way that we would be able to get that done eventually. If we had done it at the beginning, sir, then there would be some confusion, especially with our teachers in terms of how they teach, and that is why we decided to do concepts first instead of grades.
Okay, my other two specific questions are, you mentioned before about the prices.
Yes.
Someone had asked. Just to clarify, is it the reference price? Is it 27,000 you said for the tablet and 54 for the laptop?
Yes, sir.
So those are the guidance prices for the schools in making their purchases?
Yes, sir. We had initially said to the high school, was it the high schools? I think we had, yes, that is the projection that we utilized for the laptops in terms of the high schools.
And the tablets too for the 27,000?
The tablets are being procured through e-learning, so they will, based on their discounts, they will advise us as to the number that can be afforded.
No, let me clarify this for me. I have heard that grants are what being provided for the schools that they can make their own purchases, and you provided the specs for these instruments. Is that the case? That is outside of e-learning?
Right. So, Member Jackson, there is another initiative that our minister announced in Parliament, which is the voucher program,
yes,
which really is to provide a voucher of $20,000 per student who qualify, and that will be able to take care of 36,000 students. These are not only students on path, but other needy students. And there is a criteria that has been developed, and e-learning is currently putting the database in place that will manage that program, and a determination will be made as to how the vouchers are provided.
So hold on. So e-learning is not, clarify for me, e-learning is procuring a set of laptops by themselves for distribution.
Right.
Now with the voucher system, where the vouchers are being provided to the students in each of these schools,
yes, sir.
They use the voucher to buy on the open market.
So there are a set of suppliers, sir, that e-learning has been in negotiation with, so that they will sign up onto the program. And they buy from those. And they buy from those. And some of these suppliers will offer, let's say, for want of a better word, a lease agreement. So they will get like 12 months to pay, depending on the cost.
A payment plan.
Right, a payment plan. Or yes, so a payment plan, right. So that's the discussion that is being had with these suppliers, so that it will not be a strain on the parents to pay everything one time if the instrument exceeds the value of the voucher.
My next question in that regard, does e-service blacklist any companies for being on their list of from which parents can procure
e-service?
tablets? Yes, e-learning.
Oh, well, I am not able to say if they have blacklisted any company. What I can say, sir, we have pulled the companies from the Public Procurement Commission website, and we recommended those companies to our schools, that these are suppliers that they can procure from.
Lastly now, Madam Pierce, Wi-Fi access. One of my high school, both of them have two.
Yes, sir.
And they will have computers, they will have tablets, but their access, and that's not deep rural, that's in Portmore.
So
they have been talking with the, where they have problem with the providers.
Right. So, Member Jackson, what we have done, sir, the team at the ministry has negotiated directly with Flow and Digicel in terms of the provision of adequate bandwidth for the teachers who can't do the broadcast at home to be within the school's environment. Both companies, they have given us reduced cost overall in terms of the amount of bandwidth from about 10 megabyte, I think, to about 100, depending on the size of the school, and they have given us a price for each. And so this is the information now that we are sending out to our schools so that they can, the suppliers can go ahead and put the fixtures in place. And of course, we would have provided the schools with grants, their operational grant, last one that they got in September. And so if the bandwidth that is required by each school, the funds that they have is more, then the ministry will provide the additional that is required. So we are currently working on that, sir, to make sure that the schools will have that bandwidth to be able to broadcast their lessons.
Are you aware, PS, that the Ministry of Works have certain bandwidth capability throughout their system that they have established? Has that been explored to complement the commercial ones and to ease the challenge for these?
Yes, member. We met with the National Works Agency, and they showed us the areas that they're already in. The areas that they have very good fiber is really within the Kingston metropolitan area, and some of those schools are connected. I think there was a pilot with a set number of schools that they had done earlier. They have now submitted a proposal to us as to what the cost would be for them to be able to operate in other parishes, and we are currently reviewing that proposal now, sir, with a view to make a decision for them to be able to undertake that activity.
That is a government infrastructure.
Yes, sir, it is a government infrastructure. So they would only charge us for the actual inputs to get it done.
Mr. Chairman.
I'd Member Hamilton first, and then
Yield
I'm
to
sure
the
you'll
female.
yield to the lady.
Yes,
Definitely.
yes.
Okay.
I'm sure he will.
Otherwise, we'll instruct.
Through you, Chair. Pierce, this 50 million supplement for the COVID-19 response, is this the same program that was announced by the minister for the non-path students,
Yes.
36,000?
Yes, yes, member. So that 50 million was is being provided to the ministry under the CARE program, and our estimate is that we will be able to provide 1,660 tablets for students who are not on path.
Okay. 1,660.
Yes, that is our estimate, 1,660.
So what will happen to the remainder?
The remainder of the funds?
No, well, the projection was 36,000.
No, the voucher program is different, member. The voucher program is 36,000 students who will benefit from vouchers of
so that is what I was asking, if this was a part of that.
So that is different.
So
The
it's
CARE
different.
program, we were provided or advised about the provision of those funds in, I think it was about mid-August or thereabout, because we were only utilizing the funds that we have to procure tablets for students who are on path. So this was a response so that we could provide for students who are not on path.
And then how would you determine which 1,660 students benefit?
So what we did, Member Hamilton, is to contact the schools directly for them to provide us with those who are in need. Each school has a set of students who are not on path, and they are called the vulnerable poor. So their parents' financial situation may have deteriorated rapidly over a short time, or something else may have happened where they are not able to afford. And so these are the persons that we depend on the schools to provide us with that information so that those students can be provided with the tablets accordingly.
Just a question though. Out of this 589,000 students that you have,
yes,
on your records, how many of these are on path?
So I mentioned initially, sir, that we have 174,000 total. That is what we currently operate with. The Ministry of Labor will tell you that from time to time, the figures do change. In June, usually we experience a decline. And when the Ministry of Labor has done their reconciliation after the beginning of the new school year, then by the end of November, they provide us with the true figures in terms of what they have been able to validate on their database.
So you have 174,000 on path. So give and take 400,000 basically, that's not on path. But you're providing 81,000 tablets to path students, huh?
Chairman, just to mention, sir, that the 581 is representing students from early childhood to the end of secondary.
Yeah.
So the early childhood students are not usually based on their standards each
Okay,
provided
so, all right,
with a
so let's
tablet.
break it down then. How many you have in early childhood?
I would have to get the accurate breakdown, sir. I'll have to bring that up shortly. But what I can say to you is that for primary,
Yes.
we have about 110,000 students in total, and for secondary, we have about 210,000 students at secondary, and for primary, we have about 190,000. Those are the approximate
190
figures.
for primary.
190,000.
Okay, because you originally said 110. 190.
So I stand corrected.
So that's 400,000, give and take. Right? So my concern, really, and I know it's not a perfect fit and fix, but when you look and we speak about the vulnerable, and I can speak about my constituency, which is a deep rural constituency, and I have other members of parliament in here, because the first question I asked myself when I heard Member Jackson asking about the Wi-Fi connection to schools, I said to myself, why wait until now? Because I have schools, when I met with my principals, that use private providers, that if the breeze blow too hard, them can't get no internet connectivity at the schools. Why didn't we start that process before, knowing well that we had this summer period, and I know all of what was happening and your planning and things, but we knew that we would have come to this point. Secondly, even though what will happen to the rest of the cohort of students, that, and I refer to those who are not on path, who are vulnerable, where you have both parents in the house, they are the farmers, they have 4 children, and not even able to afford even a painkiller, much less a tablet to do schoolwork on. And those are the children that I am worried about. Because when you have a school that has about 140 students entering grade 7 now, that they came into the school on pathway 1, but when you do the assessment, they're actually at pathway 3. They are at home. You're sending work material to them and expecting them to basically teach themselves because they have no internet access, no phone in the house or one phone in the house. And then when you drop off that work material, pick it up back and see a blank piece of paper. How is the intervention? How is it that the ministry itself is looking at the intervention with those students who actually need the one-on-one teaching?
Okay.
Without us losing them just losing them overall.
Okay. So Chairman, there are two questions that you have asked. The first has to be why we did not start before. We started the procurement and the negotiation from as far back as May of this year, when we identified the 238 communities that had no internet access. We started the engagement of Ready TV for them to use the VSAT satellite for the engagement in 104 of those communities. There are different processes that they had to go through in terms of getting waivers from the MSET Ministry and the Ministry of Finance. And so we completed the procurement, and they are now in the process of installing in those 100 communities. We also provided a list.
Communities or schools?
Sir?
The communities or schools?
Well, it's 238 schools that are in actual communities. Yeah, so in the communities, the school is in the community, so there would be a reach in terms of the
No, that's what I want to know,
access.
if the schools itself will benefit from. Because it depends on the reach, you know.
It will be in the school, sir.
Okay, that's what I'm trying to...
The box or whatever is installed will be in the schools for
Thank you very much.
security purposes. Now, we also provided a list of the additional 138 other schools to Digicel and Flow and asked them to try to see if they can improve their network for these communities to access. And we were advised that they have done significant work where those communities are concerned. We are now yet to at least have a full report, which will come the end of this week, from those schools to see if things have improved significantly. So we did a lot of the negotiation. That is why I was able to speak to Member Jackson about the bandwidth in the schools. We had discussion with the Universal Service Fund in terms of what they were initially responsible for providing for our high schools. So we went through all of that process just to see how best we can ensure that there is access out there. We also was able to have Digicel, for example, giving the access to the learning management system. And also, what we're expecting is that within the next few months or so, the Universal Service Fund will now complete their contractual arrangement so the bandwidth can also be increased within our high school. So we would have done quite a bit of work, Member Phillips, in terms of just going through the negotiation and the procurement.
So what time frame for these schools to basically have adequate Wi-Fi?
So, because there is no, the instruction is being offered remotely by the three approaches that we have named now, the amount of bandwidth that is required at the school is less than what would be required if there is face-to-face instructions. So we are able now to comfortably provide the bandwidth for broadcast from the school, and Digicel and Flow, they are currently working with us to get that completed, and some schools have already gone ahead and got that done. And we are expecting that within the next 2 months, we will gradually see greater improvement, although we know that sometimes when everybody is on the system, then there are issues. So for example, yesterday, for example, the internet actually fluctuates significantly. And from Monday, because of the rain and other factors that affected our students there. So we expect, however, that over time it will get better. Member Phillips, we are also equally concerned about those students in the deep rural areas that will have no access to any kind of technology. That is why I mentioned earlier that we have engaged our guidance counselors, our social workers, our health and family life education officers to arrange themselves in teams or deans of discipline so they can go into communities and to, of course, in collaboration with schools, and just to see how they can find out exactly what is happening in the homes and the extent to which the students are being engaged. So it is not ideal. The playing field is not level as it relates to each child being in a class and being impacted directly by a teacher, but we have ensured that they have been provided with their textbooks. We have also ensured that there is an app that is in the Play Store with all the ministry learning resources, so those who have their instruments, they can download. And we are also going to be providing the information on memory sticks, so if they can access. And as Member Hamilton had asked, we are ensuring that every live lesson that is presented is recorded and it is stored. And after they have completed the diagnostic assessment, which is going on now, and the results will be in by next week Friday, we will now engage a set of other teachers who can focus on those children who we see significant learning gaps in their progress.
Let me just say this to you, that I know it is, this dispensation is new to all of us, but I beg of you,
yes, sir.
Look at rural schools, country schools as we call it, especially those with small populations, up to 100, 120 students in deep rural, because what can work for a Mandeville Primary
Yes, sir.
can work for a St. Paul
Yes.
Primary.
Yes.
Yeah?
Yes.
And a lot of these students, grade 6 students, reading at grade 2 level, but yet still we are expecting, and parents who are unable to even assist. So I beg of you and the ministry, just don't use a one-size-fits-all, but look at those schools, especially where the children are behind. You can see it from your PEP results, you can see it from your grade 4 assessment. Pay some extra attention, otherwise we're going to lose those students.
Yes, sir. We
My last
certainly
point is the minister spoke about assisting students assisting them with their challenges, that the pressures and depressions that they may go through. Is there a program? And I asked her the question in Parliament, and I tell you, I'm not happy with the response, because she mentioned about a telephone service that will be provided for students. The teachers.
Okay.
Will there be a separate program than just a call-in with a psychologist? Because the teachers themselves, you'll be surprised at how many teachers, because of the lack of being able to assist the students, take it hard.
Yes.
You have teachers that don't even want to leave home to come into the schools to even deliver their online lessons. Will there be a program, a psychological program, something to help the teachers themselves during this period, separate and apart from what the minister presented in the House on Tuesday?
Right. So, Chairman, there is a program that started in late July for our teachers. We engaged our teachers in empowerment sessions. 14 empowerment sessions were held across the island for our teachers, where they got an opportunity to express themselves and to express their concerns and to say what challenges, as well as made suggestions to the ministry, and also to indicate if there is further support. So we had those 14 sessions on Zoom, in collaboration, the Ministry of Health also supported those sessions. In addition to those 14 sessions, the 7 regional offices have developed their psychosocial plan. And the psychosocial plan, a major component of the psychosocial plan is to first ensure that the teachers are at a comfort level. We have worked with them in terms of allaying their fears and to get them ready for the empowerment of our students. So our region started that about 2 weeks ago. Regions are at different stages in ensuring that that is done. For this week now, Chairman, there is the monitoring that is currently being done, because it's just the reality that once somebody dies, for example, and you hear the circumstances, then some persons just fall apart. And so what we have done is to make sure that our trauma teams, and our trauma teams comprise guidance counselors, pastors, and other professionals, clinicians who are in each region. And so we have activated them to provide the support that is needed as the principals direct us. So outside of the helplines, Chairman, that Minister mentioned, we are committed to provide any further support, because we know it is not easy on our teachers. And it's almost like what you were accustomed to doing for how many years has been shifted, and you have been asked to move in another area without much warning. So we are sympathetic and cognizant of that, sir. And as other ideas come in terms of how we can engage them to support them in this time, we will do that as well. I beg you just make it an ongoing effort. Yes, sir. For their sake and the children's sake. Ms. Lee. Yes, Chairman. Oh, sorry. I thought you'd yield to the lady, but go ahead. I will. I am doing that.
Thank you. Through the chair. PS, on page 41,002, and I'm looking at our support to students nutrition program. Okay. I know we have a lot dealing with now as it relates to how we get the educational material and education into the homes of our students, but we also know that nutrition education is quite important. And I just wanted some feedback from you as to this approximately $3 billion. I see that it has been allocated to assist with education, nutrition, up to December 2020. And just wanted to have an idea from you what the program entails and when will it be rolled out into the various constituencies across the island.
Okay, so remember the estimate is showing that there is a 1.254 billion that reduction in our budget. That amount is actually being transferred to the Ministry of Labor and Social Security, where the amount that is provided for lunch per day per student would now be placed into the accounts of the parents who receive their monthly grants from PATH. Now, earlier this year, we attempted to just distribute products from nutrition products, and it really created some logistical challenges. And based on suggestions and guidance we received, we decided that that would be the best approach to provide the funds so the parents can purchase the lunches for their children. So we had our overall budget for PATH, which is feeding. The feeding component of PATH was $5.5 billion. We transferred, based on approval from Ministry of Finance, $1.2 billion in, I think it was in May, and we are now transferring another 1.254, which is represented in this estimate. Also, to advise that the Nutrition Products Limited continues to produce And what we have done this time is to ask the schools to indicate where there are needy students who still need the products that they do. And based on the listing that we receive, we also distribute those products to the schools for the schools to manage with the parents coming in to pick up.
So in other words, students who are not on path, who will not be receiving that funding via their parents' account, they can go to the schools to get snacks and so on once they're in need.
Right, and that is guided by the principal, so they would need to get in touch with their principal so they can guide them as to when to come in to pick up those products. So nutrition products will distribute at least once per week, because these products have a shelf life, and parents will be able to access these products.
Before we take another question or comment, just to advise the committee meeting, unfortunately, our chair had a previous engagement, and member Jackson will also need to go to that critical engagement. I am making a special note because it is the practice for the PAAC to always be chaired since established in 2007 by a member of the opposition. So I know you will find it strange to see me sitting here. We will continue so that we can complete the work, but it could not be avoided. And they're asking, or what would I say, for us to understand and give due consideration. So we will continue, Member Jackson.
Indeed, Madam Chair, and I just want to add that we felt comfortable that the proceedings would be done well in your capable hands.
Thank you, Member Jackson. All right, so we will continue. Member Whittle is now on the floor.
Thank you, Madam Chair. A question for our PS. Given the fact that, given our current challenges as it relates to the accessibility of students in the various rural communities and so on, what kind of consideration is being given to, in terms of your preparation for the primary exit program next year?
Okay, so Member Whittle, I indicated before, based on the revised schedule that the ministry has, this week and next week the schools are focusing on psychosocial support and the administration of the diagnostic assessment. So we had designed diagnostic instruments because we know the students were out for about 6 months. Those are being administered now. Some are being done through the Google platform, some are being done through hard copies, but it's purely diagnostic. Now, based on the results that will come to us by next week, Friday, we will do an assessment to assess the learning gap, generally speaking. Of course, the regions would send that information to Central, and we do the national analysis. Based on that, we will do an adaptation to the curriculum, which is to look at the national standards curriculum and determine the key areas that the students must complete within the time frame of the period that we have for school. Based on that now, we will decide on the approach that will be used for the primary exit profile. So there are 3 approaches that we have already contemplated. So once the results do come in, we will present those to our minister for review and a decision, and then we will provide that information by the end of October to our schools in terms of the dates for the assessment that will be done and whether or not we will be using any other grades that the students may have done before the COVID started.
The assessment, will you factor in the matter of student A who might have an electronic device to access to education, as against student B who may not have had that privilege over the period of time? How would you determine their grades? in terms of the entire process for
Okay.
placement. In
Right.
Yes. Before you answer that question concerns me deeply, because assessment is not the only thing that is critical to a child going through the system. If you weight the assessment based on the availability of having had an instrument, it still means that the child does not possess the requisite knowledge and skills at the same level of another child. So I would want for us to think about where we are going with ensuring that between printed material, who has tablets, who doesn't have tablets and laptops, that the Ministry of Education, principals, teachers, and schools understand that all Jamaican children must get back to where they should be, or else extra classes and whatever is necessary to get them through the next school year is going to be required, and we will have to put it in place. So member, I wouldn't want to dream about stratifying children based on the provisions of the ministry that they would have had access to, because ultimately what matters in stratifying children is what you have learned. And when it is all said and done, if you don't have the knowledge, you just don't have the knowledge.
This is the point I was trying to make. We are at a position now where we are not certain as to whether we'll be able to give to all those students the necessary support that they would need. At this point, we are not sure. So that is why I raised the question.
Right.
Is that, what will happen if
Yes. So Member Witter, that matter you have raised really concerns us deeply, because we know that PEP is a high-stake exam, and it is really determining the future of all our children. So outside of what Member Holness has said in terms of ensuring that the progress of our students is not only dependent on an assessment, we still have to bring both together to find a way to make sure that there is equity in the results. Because we started the primary exit profile in 2019, and it is a 3-year program. The grade 5 and grade 6 students that we have now, they would have done at least one paper, the performance task, under examination conditions before COVID. So those are grades that we have, if things are normal, would have contributed anyway to the overall assessment. So based on the approaches that we have worked out, those will have to be taken into consideration, depending on which approach we use to do the final assessment. But I must say, what Member Holness has said is what is of critical importance, is the assessment of the learning gaps and the ability of the ministry with its officers to have other sessions that we can bring those children up to standard. And that is why what we are doing now as we speak, pending the diagnostic assessment, is to engage Edufocal and one-on-one educational company, which are 2 companies that have done a range of areas in terms of PEP, and they will be able to assist us in engaging those students. And those that we cannot reach through the technology, we have to find a way to provide other means in terms of our teachers and our officers actually going into the communities to support those children. So it's a very comprehensive and somewhat difficult activity, but it is something that must be done to prevent our students from not maximizing their potential during this pandemic. And the ministry is prepared to do whatever is necessary to ensure that we make up for those learning gaps that we know exist in our students.
I think if we have no further questions, we may release the Ministry of Education and invite the Ministry of Labor and Social Security to take the position. Come a little closer. PS Risden and the members from the team from the Ministry of Labour and Social Security, welcome to our first PAAC meeting for this budget year and term. We don't have a lot to entertain you with today. Thanks for your patience. You have one major reduction in expenditure, program for pensions to the elderly, by I think $800 million. The indication was that there has been some delay. Why has it been delayed, and when are you expected to start?
Okay, thank you very much, Chair, and good afternoon, members. The social pension was slated to begin rolling out this month, actually in October. However, due to COVID, and the program is targeting elderly persons who are not in receipt of any form of pension, disability benefit, or anything, no means of income support, that program would have been targeting those persons for some kind of social protection support from the government. So, Chair and members, a lot of the delays has been due to the fact that COVID has prevented us from finalizing some of the program development or MIS system in terms of the development, because it is the same staff, the same social workers who have been responding.
Yes, you may have to take off the mask.
You're
sort
not
of
hearing?
want to,
Sorry.
yes, it's not very clear. I wanted to have an idea as to this social pension for elderly, exactly what it would entail first. COVID would have been from about mid-March. I'm not so sure exactly what we're doing with the elderly, and if it is delayed and it is resulting in such a significant saving, which we wouldn't want to be seeing, the need is still there. Mm-hmm. So I want to get an appreciation for what we're doing currently and how soon will we catch up with servicing the needs of our seniors.
Okay, so the social pension program was a new program that was put on the books just before the end of last financial year, just at about February, actually. So the timeline, Chair, if I must admit, to even design and implement by October was a very tight timeline to begin with. Nonetheless, we recognize that there is a group of persons out there who are not on path. They're not in receipt of an NIS pension. They're not in receipt of an overseas pension, because we do have persons who worked overseas and have retired here. They don't have a private pension. They don't have children who are supporting them. And so this program is aimed at targeting that group that we recognize as you age, your vulnerability and your ability to provide for yourself certainly increases. So this program would have been targeting those persons. It was the age group would have been higher than the current NIS age cohort. When I said higher, meaning NIS, you become eligible to begin receiving your benefit at age 65 for national insurance. So we were really targeting the elderly of the elderly, if I may put it that way, to receive some kind of support. It is part of the government's thrust to improve our social protection system for this group of persons.
You may go ahead, Member Hamilton.
Thank you, Chair. P.S. You mentioned the age cohort, but you didn't give us a specified age where you would start. Is it possible for us to get that age?
And We are actually toying with 2 age groups, and one of the prime reasons is a social pension is we have to ensure while we are satisfying a social need that it is also fiscally sustainable. So those are some of the details in terms of the program design that we're working out. There are some schools that say we should begin at 75, a little more conservative. There are other schools that say begin at 70. But it is, we are doing the analysis to ensure that when we roll out such a program, that we don't run into the challenge that we're not able to provide for all who really are in need of this assistance.
So you answered my follow-up question, because I was going to ask about the target in terms of the numbers. But based on your response, I realize where we are.
Yes, so we're doing a lot of that work and design.
Yes, are you at a place where you have already worked out how many persons, if the age limit is set at 70, how many persons, if it is set at 75, and how much would the budgeted amount be if we had X number of persons times Y in amount for the benefit, to see exactly what those budget numbers would come out at?
And yes, we have worked those out, and we are in the process of preparing a submission to Cabinet for those approvals.
Member Sibley's.
Thank you, Chair. Chair, the question is really, we are now October, and we have not spent anything from this fund. They're writing it back? So
yes,
we're writing it back with the intention to do it for next
fiscal year, yes. Yes. So member, I didn't answer another part of the question, which was about the timeline. So we are expecting that in another week or so, we're going to be eliciting the comments from the Ministry of Finance, and we are going to Cabinet for final approval. And if all goes well in terms of our timeline, we're expecting to roll out, at least begin promoting this program early next calendar year, for early in next financial year to begin rolling out in terms of actual benefits.
Thank you very much, and thank you from the entire team of the ministry. We won't delay you much further. That was the key item of concern as it related to the Ministry of Labour and Social Security. Thank you.
Thank you very much.
So we'll next take the Ministry of Local Government and Rural Development. That's a new name. Could we ask the Ministry of National Security to come in as well, please?
$7,200, Chairman.
Welcome to the Ministry of Local Government and Rural Development, Permanent Secretary Marsha Henry Martin. I think this is the first time I'm at a PAAC meeting with Mrs. Martin as the permanent secretary. All right. Team from the ministry, welcome as well. Thank you for being here this afternoon. All right, so PS, you may go ahead if you have any concerns. I'm looking at your numbers, and your adjustment is $265 million. At direction and administration, and I've seen you giving some indication, majority of which is goods and services and compensation. Not seeing anything that is really earth-shattering and critical. Is there anything that you would want to tell the committee?
Okay, good afternoon, Chairman and members, and my colleagues from the Ministry of Finance and the Public Service. Just to indicate that, in fact, with the adjustment of the ministry to rural development, well, local government and rural development, we would have received additionally the subjects of rural electrification and rural water. And so that increase that you're seeing of 265 is in relation to rural electrification services. And for rural water, you're seeing an increase also of 130 for recurrent expenses. And there is also an increase in respect of the capital budget under rural water for $250 million. In respect of any concerns, in the present situation, we are very mindful of the challenges, and we really are very also grateful to the Ministry of Finance, who remain very supportive of the ministry. So there were in fact some areas that we had requested that were not reflected, that we will remain in dialogue with the Ministry of Finance and the Public Service towards how we will address those areas.
What are the critical areas of need and the estimated amounts being sought of the Ministry of Finance in respect of those areas?
So that area would have been the continuation of the feeding program for the homeless in respect of approximately 76 million for the period of October to December.
I'm a bit concerned, PS. Is that in addition to what you would normally spend, would you have had a reduction in the amounts coming across to your ministry? What exactly would have resulted in that $76 million shortfall?
Chairman, it's a continuation of the program. So since the onset of COVID in March, the ministry had embarked on the feeding initiative. Right, and so we had projected that maybe by about August we would have tapered off, but we're not seeing that, so we had to alter our projection to a future date, which means we would need more assistance.
Any other questions from any of the members? None? PS, we will not keep you. I have actually observed the feeding program in Kingston and St. Andrew in particular. I believe it is critical. It is one that is needed, especially now during COVID times. I'm not so sure how we manage across the rest of the country. I've not seen the feeding program exercised in any of the other parishes because I guess I spend too much of my time in Kingston. But we, from our end as well, will also be advocating because we have picked up in our various constituencies the level of need. You would be surprised to know people you thought had money and you thought did not need food are actually in need of food packages. And so I know that area is almost an emergency, just being able to survive and not going through starvation while we employ all the other measures of coping with COVID. So we will be going back. PS, do you have, and that is PS Morrison from the Ministry of Finance. I noticed that you're looking sideways, wondering where we're going to get the additional money from. But for this particular area, we would like to also ask you to impress upon the Minister to find the funding. $76 million more to feed those who are homeless and desperately hungry. Okay, PS? PS Martin. Oh, PS.
Just saying, noted, they do have an allocation of 22 million, 22.8 to the program. All right. Okay, I was just pointing out that there was an allocation of 22.8 million to the feeding program in the second supplementary.
This is out of the 76 that's required, PS? The 22 that would have been given, that was just mentioned, is out of the 76 that's required?
No, that reallocation of the 22 was for the month of September. So the project, what we're talking about is for October, November, December, which we will remain in dialogue with the Ministry of Finance and Public Service.
And from the desk, PS, I'm asking PS Morrison to also, from the PAAC committee, take our own plea in addition to that of the ministry to our dear Minister Clark to find that additional funding of the 76 million to take us to December. I think it's a commendable program. I'm sure some people were concerned about where we house the feeding program in Kingston in particular. It may not have looked as attractive to see the persons being at the space and needing to be served, but it was certainly needed and certainly critical. And I know it is appreciated, and it's a program that we should dig deep to support as long as we need it. I hope that past December, we are not in a position that we are still needing to do this level of feeding. They are actually one of our most vulnerable groups, and as I said, P.S. Morrison, I found persons who should not have been needing food, needing it. And if you look at those who are homeless and have nowhere else to go, once we're in a position where some persons are losing jobs, things are tightening up for individuals, it means they have less to give those who are even less fortunate. So I'm asking you to just go back to the Minister of Finance, FS, and make that plea on our behalf. Thank you very much. Ministry of National Security, you may come across. Welcome, Mr. Courtney Williams, Permanent Secretary in the Ministry of National Security. I won't say anything more than that. Welcome to the rest of the team. I recognize him from my days of school. So, welcome in many respects. I think this is the first time you would also be representing the Ministry of National Security in this particular capacity. Welcome to the remainder of the team from National Security as well. I'm going to make sure I just complete some perusals, but I would like you to start on the recurrent side. I notice a massive jump, $1.9 billion in additional expenditure for none other than compensation of employees. So I would love the ministry to start there and give us an idea as to why this significant adjustment is required.
Thank you, Chair, and good afternoon to all the members. I will just begin by saying for the Ministry of National Security and the related departments, the allocation for the second supplementary estimates, those allocations are broadly in line with what we had from the first supplementary estimates. The most significant change, as you mentioned, Chair, would be that $1.9 billion allocation related to compensation, specifically for the Jamaica Defense Force. And you would understand that in this type of setting, we don't go into that kind of detailed discussion surrounding the budget of the JDF. But if you take out that allocation to the JDF, the increase within the central ministry and the other departments are relatively in line with what we had for the first supplementary, as I said before. For example, for the central ministry, the recurrent increase is $406 million, and most of this relates to COVID-related expenses in terms of procuring equipment, PPE equipment, and some social intervention programs from the FID through the JSIF. So that's a part of the increase. For the police, the increase for the police is $800 million, and that is less than 2% of the police total budget. So it's not much of an increase there. Part of this relates to some holiday pay for members of the JCF, as well as that's about $500 million, and around $200 million for general expenses relating to general operations like training, meals, COVID-related expenses, and so forth. For the Department of Correctional Services, there's a $274 million. Again, less than 3% of the budget, so we're not talking about a substantial change there. And the bulk of this, about $176 million, is to purchase PPE and related supplies for the correctional facilities. And the other major agency where we would have seen an increase is for PICA, a $500 million increase there for PICA, and this is really to offset, to get some support from the consolidated fund within the context, amid the shortfall in revenue that PICA would have experienced, given the pandemic and the reduction in traveling, closure of the borders and so on. So there are less revenue coming in for PICA, and hence they are seeking support from the consolidated fund. So support is primarily for salaries and compensation for wages. Right, mainly for that. So in a nutshell, those are the areas of we would have seen any change of note. And as I said earlier, it's not that significant of an adjustment within the Ministry of National Security and the related departments and agencies. Okay. Thank you, PS Courtney Williams. I will say on behalf of the PAAC committee and team of members that we would like to continue to thank our security forces. We have been out there as members of parliament, both observing the conditions, the hours under which both the JDF and the JCF have worked in supporting our communities through the COVID period. And we would like to use this opportunity to tell them once again that we
commend their efforts. We appreciate them, and we wish them Godspeed in continuing to execute their duties from day to day. I pray that Jamaicans will get to a place where we have a deeper and deeper appreciation of the sacrifice and the commitment that our frontline workers make, particularly those in the force, both the police force and the JDF. Thank you very much. You may go. So the next ministry will be that of the Ministry of Transport and Mining. Welcome to the Ministry of Transport and Mining, the Permanent Secretary, Dr. Alwyn Hales. I hope I'm pronouncing that Hales properly. Once again, we will not need to keep you very long. Our primary area of interest is the amount of wages going into the tune of over $1 billion, particularly coming from the wage negotiations for authority for the period 2017 to 2021. It's a large settlement. I wanted to get a little bit more information on that particular additional budgeted expenditure.
Thank you, Madam Chair. That expenditure primarily relates to the Civil Aviation Authority and wages settlement, retroactive payments over a 4-year period. The Director General of the JCAA, Mr. Nari William Singh, is sitting right behind me, and I'll just give him an opportunity to quickly explain.
Thank you very much, Chairman, members, PS. It's primarily for 3 groups within the authority. The Management Staff Association, the Aviation Safety Inspectors Association, and the Air Traffic Controllers. And as PS said, it's for the 4-year period, 2017 to 2021. So it's the majority of the staff at the authority.
Would you give us some idea as to, is it an increase in terms of a percentage increment and then it is paid retroactively? Sometimes when you have that discussion, it almost sounds like it's a settlement. It would appear to us on the surface that it looks like additional back pay. Could you be very clear in that regard?
So the agreements were signed just this year. So the payments, the new rates would have been paid, and then this is the retroactive amounts to be paid.
Madam Chair, so the Aviation Authority, they were not a part of the current government's wage agreement with the other sectors.
One group was, which was the BITU, but there are 3 other separate bargaining units.
There was, okay, so arising out of the discussion, those bargaining units, you didn't come to any agreement as it relates to the national agreement with the other public sector workers.
Thank you. Through you, Chairman, we were guided by the parameters that we were given from the Ministry of Finance in reaching this settlement with the other 3 bargaining units.
Member Whittle, I am getting a clear indication that over a period, because of different unions representing different segments of workers, there would be some who would have had increases before and others awaiting increases while they use their various bargaining organizations and mechanisms to come to a place. So we're finally at a place where it's settled. All the rates are now ready to go. I notice it says to 2021. Does that imply that in the budget year 21, we are going to see a fresh round of additional bargaining taking place for increases again, or are we there? I'm not so sure what the agreements speak to. So I notice the period for the figure runs to 2021. I'm just trying to figure out if we can look forward to seeing another round of increases coming through Jamaica Civil Aviation Authority.
Yes, Chairman, the agreements that were signed were for the period 2017 to 2021.
That is about March 2021, which means it is in tandem with this budget year. When the budget year closes, that's it. And a fresh round will start in the new budget year.
That's correct, Chairman.
Okay. All right. Are there any other questions from any other members? Member Hamilton?
Quick question, Director. So now that we know that there will be fresh negotiations come after March, April, have we started those negotiations from now so that we can at least know where we are come the next budget?
So at this point in time is when we would start to receive claims from the bargaining units. We haven't received any claims at this point in time.
But should we be proactive then and not wait again for a protracted period of negotiations so that we don't see another 1.1 billion coming through?
Well, we have been in constant dialogue with our groups, especially since March with the COVID pandemic, to try and set the stage for the next round. And we are seeing the statistics in aviation. I mean, we're down 70 to 80%, you know. So we are setting the stage for the next round.
Quite correct. I'm actually in agreement. It makes a lot of sense that persons who are looking on, even from the place of the organization, you will start creating both a mindset in the employees as to where we need to go, and you would have already started to get a sense as to how they feel going forward. It would be remiss of me not to ask, how long is the contract period each time around? Is it for 1 year? Is it for 2, 3, 4 years? What are we to expect in the next negotiation?
Well, Chairman, typically there were 2-year agreements, and in fact we were working on 2-year agreements when the government then pressed for a 4-year agreement. So we were able to extrapolate and sign 4-year agreements, which expires at 2021. Given we actually prefer a longer period. You know, it gives you more stability. So
we're looking forward to seeing another 4-year agreement at minimum being signed going forward. All right. Thank you very much to the team from Ministry of Transport and Mining. Sorry, before you go, I must ask one other question. And if you're not prepared, you can say comfortably no. I noticed in reviewing the reports from the statistics given in terms of our growth, Ministry of Mining had a significant reduction. 25% was the reduction in your growth level or performance level over the period as a result of COVID. And I couldn't understand it. I decided to leave the question because I came back at education. But mining and quarrying fell in terms of its contribution to GDP by some 25%. And during COVID, I couldn't understand, with equipment and people working far away from each other, why we weren't in a position that we were able to continue mining and mining and mining.
Well, we've had we've had a significant fallout during the beginning last financial year, in fact, with the closure of the plant down in St. Elizabeth. That's the Alpart plant. So that would have explained it primarily.
Thank you, PS. Appreciate it. Okay, thank you very much. We will now welcome the Minister of Economic Growth and Job Creation.
Good afternoon, Chair and members of the committee.
Good afternoon.
And my colleagues from the Ministry of Finance and the Public Service.
PS well, I've not asked most ministries to introduce all the team, but since your team is looking rather small and you are the last ministry to spend a little time with the members of the PAAC today, I'm going to ask the members to introduce themselves, particularly for the benefit of new members we have here today.
Okay, Madam. I have with me Mr. Everton G. Hunter, E.G. Hunter, CEO for NAA. And with him is Mr. Varden Downer, Senior Director, Implementation and something else. And the PFO for the ministry, Mrs. Judith Rob Walters. So I know most of the questions will go to Mr. Hunter. We work as a team, and what I cannot answer, he will.
So PS, we wanted to first take, for your ministry, the capital side. It is one of the ministries that have the most significant increases, and particularly for the capital budget.
Okay, just a little overview though, yes, for the benefit of the committee. Overall for MEGJC, there is a split off to form the new ministry, Ministry of Housing, Urban Renewal, Environment and Climate Change. So what we have in our budget, and is being addressed through the supplementary estimates, is adjustments from MEGJC to the new ministry. So I think we have about over $900 million being shifted to go to the new ministry. And all the areas under that ministry would have been provided for. For capital under MEGJC, which primarily now has infrastructure, works, infrastructure, water, land, and planning and development, among other areas, we have adjustments to road habilitation project 2, where initially we had got $67 million only, and we have an adjustment of $321 million. And for the Southern Coastal Highway Improvement Project, there's an adjustment of $4.6 billion. In terms of reduction, though, we would see some reduction significant for the Montego Bay Perimeter Road, because we have had to adjust the schedule in terms of what was planned for this year. We had planned initially and had got approval to proceed in a particular mode, but things have happened, and we have been advised by the Ministry of Finance in terms of a change. So we have now had to go back to the drawing board and to go back to cabinet. So it will affect our schedule. So whatever was planned before, we will not be executing in that way. By and large, the other adjustments you'll see on the budget In terms of we have also, provision is also been made, $500 million for island-wide disaster mitigation, and I am sure that Mr. Hunter and his team will tell us that that is not enough because most of those funds are spent already or committed. So if there are specifics, Mr. Hunter will respond.
So, Mr. Hunter, in terms of the road rehabilitation project 2, PSOL would have spoken about the 321 million. We will not harp on that, or the Montego Bay perimeter road. What I'd love to find out, though, is what would have accounted for the $4.6 billion adjustment on the South Coast Highway. What happened in terms of timing and scheduling, why that occurred. We would love to have a deeper appreciation for what is happening with climate change and why we are seeing a savings there from the IADB grant. I'm not sure what
remember, climate change has gone over to the new ministry.
Oh, gone over as well.
So we are seeing savings.
Okay, it's in this.
In most instances, they relate to the shifts that have been, the transfer to the new ministry, yes.
Okay, all right, Pierre. And one other. Okay, and I'm sure, yes, this would have also gone over to housing, urban renewal, the reduction in the construction maintenance of water supplies. Okay, so over to you in respect of the timing, I'm sure, or additional expenditure required for the Southern Coast Highway Improvement Project.
I'm sorry, and just before Mr. Hunter responds, just for the benefit of the committee, the South Coast Highway Improvement Project is being done in 2 different phases. One being done by NROC, which is from Maypen to Williamsfield, the toll road component, and the other is being implemented through NAA, which is the Harborview to St. Thomas, Port Antonio leg.
Good afternoon, Chairman, committee members. Just to close off where the PS started, it is my understanding that this very robust additional provision on the South Coast Highway project is all to the benefit of NROC and the toll road component. Nevertheless, to the extent that there are any adjustments to that, we'd be happy to receive some of that.
So what we wanted to have an appreciation for, is this an additional amount being budgeted to be spent on that leg of the project, on the toll road leg, or is it a timing difference in terms of the volume of work completed versus projection, resulting in the additional spend being brought forward?
Okay, so let me address that generally. Now, when we met for the first supplementary, you may recall we had very detailed discussions regarding the precipitous reduction in the original budget and how we were going to manage that, because the South Coast Highway improvement contracts have been executed. So those contracts are in place. And those contracts speak to the delivery schedule or the completion schedule, and therefore that precipitates a certain rate at which work is to be done. So when the original budget was cut, you may recall we had significant hand-wringing in terms of how we were going to accommodate the reduction in the budget, but at the same time try and maintain some semblance of fidelity to the original schedule. And that has been a lot of juggling, and we have tried to balance the rate at which the expenses are incurred so as not to upset the fiscal framework, but at the same time maintain some amount of velocity on the ground. What this increase has now done is to make that juggling act a little bit easier. Because, so it's not an increase in the contract sum, but rather, as you have indicated, a timing provision. So hopefully, at the end of the financial year, assuming that the contractor continues to work, there will not be any significant overhang going into the new financial year, because we're very conscious about not wanting to prejudice the Minister of Finance's position in respect of that. So it's really a timing, essentially, a timing matter.
Okay, thank you very much. You didn't see the eyebrows raised over on the committee members' side, wondering if it was an increase in expenditure all going to NROC. I will then ask some questions as it relates to, unless somebody else has any other concerns as it relates to the capital budget side. Any other questions from any members? All right. I actually decided not to get into those questions, but let me do so. So, not to prejudice the situation, the South Coast Highway, there were some concerns. And just for the benefit of the public, we would love to appreciate what is happening in terms of our land acquisition to be able to get that project from the Harborview end going to Portland up and running at the speed expected. That's number one. I'm not sure if there are any issues on the toll road end. Number two, what is happening in respect of the completion of designs? Where are we in keeping with our timelines? And are we at this stage projecting for the South Coast Highway to be completed as promised, or are we looking at new estimated dates based on design issues, based on issues with contractors, based on land acquisition issues? Where are we?
Okay, Chairman. Land acquisition has historically been one of the most problematic aspects of any project implementation, because how it works is that the NAA, we would design the road and we would identify the properties that will be impacted. A cabinet submission is done and sent to cabinet to say, dear cabinet, we have an interest in these parcels. The extent of the interest will be defined later on. And we have to give an idea of the probable costs for government to acquire all these parcels. Once cabinet approves that submission, then we get into the actual details of the plot-by-plot acquisition. The lawyers will tell you that on average, perhaps less than half of all the landholders in Jamaica are registered. So when you get there, there are no titles. The person who lives there is not necessarily the person who... So it becomes extremely complex to acquire property. Now, from the NAA's point of view, we are not really interested in an acquisition, because acquisition implies change of ownership. We really are interested in possession, so we can go on the property and do work. However, that is easier said than done, because the average person who lives on the property are very concerned about their money. They're very concerned about the disturbance to their habitation. It has a lot of social and sociological implications. We work very closely with the National Land Agency, who has the legal authority to undertake the acquisition. We provide backup services in terms of the surveys. The NLA handles the valuation. The funding comes to us and we handle the payment. Each project, for example, on the South Coast, there are 392 parcels of land that are impacted, various stages. In fact, I may just indicate that one of the parcels of land to be impacted is the existing Bulby police station. Just had a conversation with the Ministry of National Security team when we were outside. They obviously want a replacement police station. Their existing police station is some 3,000 square foot. They want a 7,000 square foot replacement. The price tag is in the range of about $250, $270 million.
Let me interject. I'm sure you will be giving them the section you're removing, and national security will be funding the rest of what they dream and desire to have.
Those are my instructions from above. But again, you know, we have to negotiate. Generally, the government tries not to acquire properties where we have to get property and building. We try not to do that, but in some circumstances, we have to get the building. So when you move from the value of the property to replacing a structure, it has severe implications for the budget. So we have to negotiate these things and come to some sort of amicable agreement within the time that the project is required. It's a live contract, and the contractor behind us ready to acquire the land. So of the 393 parcels of land, we have a schedule with the contractor where we will deliver to him the parcels. We gave a dump to the contractor PS a couple of weeks ago. We sent him a whole set. Again, we choose the locations based on the degree of difficulty. So, in fact, if there are several parcels which are unoccupied, we would want to attack those parcels first, because the parcels which are occupied tend to be more problematic. So, you know, we try. But suffice it to say that we have a good team working with the NLA, and we are confident at this point in time that we will be able to deliver all the required parcels. It's not going to be without difficulty, because when people have lived in locations for generations, sometimes there are graves to be relocated, and that has to be done in conjunction with the Ministry of Health. So it's not a gimme, but we stick to it. Does this have implications for the completion of the project? We have tried our best to undertake the entirety of the project as close to the original schedule as possible. That's our objective. Two things have impacted that. One, COVID. As you know, there were a number of outbreaks in St. Thomas, and some of the sites had to be closed down, or the level of activity had to be scaled back in keeping with the understandable threat. So that has affected progress in a number of locations. And the other main item that has impacted the proposed completion, it's a very good thing, but it does have its consequence. The government, some 3 years ago, if I recall, took a policy decision that whenever we're doing any major roadworks, that we should incorporate in that undertaking the entirety of infrastructure needs, meaning if the NWC has a water need, that is incorporated. If there's a sewage need, that's incorporated. Telecoms, we put in everything. So the government did attach to the roadworks contract a supplemental contract for the waterworks. And so that involved design of the works, procurement of the pipeline material from abroad that to be shipped here, and those are to be incorporated in the roadworks. And we have made an adjustment in the timelines for that, which is a major activity. So we think we will be coming in, we're looking at no more than about 6 months outside the original schedule, tentatively.
Well, let me interject here now, Mr. Hunter. I have some intimate knowledge of sections of the work because it goes through my constituency. And since I love construction so much, I made sure I had a deeper appreciation. What concerned me is that we are building in 2020, and my expectation is that these roads should carry us 50 years and beyond. And I see no sewage in the planning for the Harborview into Bull Bay area, which means that all these thousands of people living at 7 miles and 8 miles and 9 miles and 10 miles, when they see the development coming and see the wonderful highway and decide that they want to put in all these Airbnb and the explosion takes place, we do not understand where the sewage would go. So I would love to find out if the NWA and the Ministry of Finance can go back to the drawing board just as it relates to sewage and see if we can add that in the design so that we put in the sewage pipes now, we leave them blank, we tee them off at designated areas and cap them until we can afford to get into the relevant communities, but at least the provisions would be there and we would not have to ever dream of going back, having spent so many $1 billion to dig up those roads to get sewage running along the Harborview to St. Thomas stretch.
Okay, so that's a very good observation to the extent that sewage, the carriage of sewage will be on the highway. The fact that it is not now incorporated in the present design, yes, we can look at that to see to what extent it's feasible. But having had a little experience in that area in my previous life, there are workarounds to that. What one would look at is where is it that the development would take place, where do you site your treatment plant, and then you then do your collection system from where habitation occurs to where the treatment plant is. And so there are workarounds, but it's something that we will certainly look at, and I will have a discussion with the NWC to find out what's their perspective and what's their plans. But certainly we have absolutely no intention of going back and excavating this road. I give you that as our commitment.
Thank you. Are there any other questions? Member Whittle?
Thank you, Madam Chair. Mr. Hunter, I know that might not be a part of the supplementary in front of us now, but I know that I think it was last week, there was a serious problem that was developed along the St. Mary, the junction, right? Where are we in terms of facilitating that challenge that we have up there?
Okay, so let me first declare interest. I am from St. Mary, although most people think I'm Kingstonian, but that's fine. So I do have a little familiarity with the turf. Now, I keep reminding people that on the North Coast Highway that runs from Negril to Port Antonio, there are 2 locations where the soil just went, and after many, many efforts, they still remain. Okay, and the Chovy breakaway is not very far, and geologically, it's basically the same formation that we're talking about. So the point is that those areas are susceptible to that kind of soil activity. So it's not something that is, bad design or bad this or bad what. It's what we're working with. Specific to the Chovy area, that Chovy breakaway was identified years ago to be an area that wanted attention. To wit, a design was done for that area. That design was costed and negotiated with the contractor, and proposal made for that to be financed. But again, like everything, government can't do, well, let me not speak for the government, but I realize and accept that not everything can be done at the same time. It would have been nice if we were able to finance that contract on the schedule that we had originally wanted to implement it. Because the idea was that we didn't want the contractor doing the roadworks to vacate the area before we tackled that problem, because it would cost us less in terms of mobilization. Regrettably, COVID absorbed most of the resource, so we were not able to address the matter then. In terms of, just for the facts of the case, the project on the junction runs from the Agualto Vale roundabout to Broadgate in the first instance, and that's 4.6 kilometers. The breakaway covers 65 meters. Okay, so it's a relatively small area along the corridor. The entire project in the junction, again, just for comprehension, runs from Agualto Vale in one extreme to Toms River in the next. That is the project as defined and designed and to be implemented. And that is the project that one would then evaluate to see, has the project had the impact that we anticipated? Because, again, some of the early commentary I've heard is that, well, you're finished with your Broadgate, where's the big benefit that the project is Agualto Vale to Toms River. And it is my understanding that the government intends to implement the entirety of the project. It is a difficult area. I mean, the soil type is noticeably fragile and does cause some problems, but we're confident that we will be able to solve that. So we do have a design for the Chovy area, and it is now being funded in the supplementary estimates. And so that contract will be awarded shortly, and they will proceed to implement those works.
Mr. Hunter, I see an additional $500 million projected as well for disaster mitigation, what we call almost like flood damage and the works. I won't even ask you if it is adequate. I would like, just for the benefit of the public, being in a rural constituency and one that is not having landslides because of soil necessarily, but shaly type mountainous areas, and it is like everywhere. Could you give us any sense of hope? This chairman, Member of Parliament for East Rural St. Andrew, with 1 day of rain, by the next day had 2 major landslides in Maryland, 1 major landslide at Craig Hill, a major break-off down at Cane River. Byton Bloxborough that you just worked on was now impassable again. Another landslide in Content, 1 in Mount Lebanon, 1 in Mount Charles, and 1 in Top Road. I do not think the appreciation is there, because a lot of persons started to explain that we can do like China Harbor and we can mesh the entire East Rural St. Andrew. And if we mesh everything, it would save us money because we wouldn't have landslides. So I would love for you to give us an idea if there are really any options out there, and help Jamaicans to have an appreciation of the zillions of dollars that it would take to do something like that in any constituency. And somehow have them appreciate that no matter what happens when we have these flood damages in constituencies like mine that are susceptible to significant deterioration overnight as a result of 1 day of rainfall, it will just never be possible to find all of this money all at once to fix everywhere. And I would want to still advocate for you to find some more to come in and assist us, because we are in trouble.
Okay, so let me say very quickly that, you know, my response, you know, this is not government policy. I'm giving a perspective from a professional point of view. And the truth about it is that the infrastructure that we have on the ground now as we speak all over the country is infrastructure that was installed 50, 60, 70 years ago. Now, any engineering structure that you design has what we call an engineering life. It doesn't last forever. It's not like salvation, right, PS? It doesn't last forever. So it has a finite engineering life. And at the end of that engineering life, if you don't make an intervention to extend the engineering life, then it becomes inadequate. So if the drain is 2 foot by 2 foot and it was built 60 years ago, you cannot expect with the expansion of what we call the impervious cover, roofs and parking and more runoff coming, it will not do. And it doesn't make sense you jump up and quarrel because the only solution is a bigger drain. Now, so that is one. The second thing is where we choose to live. And I remember some years ago there was rain in Portland and helicopter had to take food to the 10 people who lived up there. Mr. Downer took me, and quite honest, I said to him, if I knew that that's where it was taking me, I wouldn't go. Because, I mean, we're going up a precipice, and if something happened, it would take 6 months to find me. And I'm a coward. The truth about it is that the country cannot sustain habitation in those areas. To provide urban service, you know, I go Mount Russa. How does an ambulance get up to Mount Russa at 2 o'clock in the morning? How does a fire truck get up there at 3 o'clock in the morning? I mean, wouldn't it be strategically more affordable if persons were relocated down to Yorton, for example? You know, the truth is that it has historical reasons. I'm told that when our forefathers left the plantation, they went up to the hills and so on and so forth. But the fact is that the country cannot afford the infrastructure to support habitation in the areas where a lot of people choose to live. And I've seen things commentary in public media and social media about quality of engineering and all kinds of speculation. Engineering is not conjecture, it's science. And if the infrastructure is a little track on a hill, and the hills will always erode until it gets to the angle of repose, and people just have to accept that. So habitation is one thing. Where people choose to live, you know, the age of the infrastructure, just normal things. When you drive around, we have drains that have inlets, and they're all clogged with plastic, and you know, they're just a myriad of things that mitigate against an orderly way of doing business. So, final thing, in a lot of the rural constituencies, Madam Chairman, there are lots of parts of constituencies that ought to be confined to forestry and farming and so on and so forth. And you have gravel roads, but to try to build carpet up in those areas is unaffordable. But then I don't have the final word. So.
Thank you very much. You gave your personal view in some regards. I have been just as strident with my own constituents about the impracticality of 20 persons living sometimes 15, 20 miles away, and you have to cross 3 rivers to get to them. And the perception is that you should come back and fix that area over and over again. I've actually started to encourage some persons to prepare that you may have to live one place and your farm is in another place, because the intent at the time was that we take the donkey and the horse and buggy and go up to the farm, and then we come back to our home when we are finished. And you may be stuck at the farm 2 days, you can survive. But if you're in a situation that you have to daily traverse in areas that are 20 miles away before you get to the first house, the government will just never be in a position to be wealthy enough to maintain some of those spaces. So we really have to encourage Jamaicans who have chosen to live in certain spaces that as a collective we have to really revisit because it is not practical, some of the expectations. Member Hamilton?
Thank you, Chair. We appreciate what was just said in relation to where persons choose to live. And we know that where areas are remote, it is difficult to manage and maintain and respond where access is concerned. But what about areas where people are living on the flat, for example, accessible areas that still have issues going into their communities because of, for example, not having a bridge? I see you know where I'm going with this one. We have around maybe 300 persons or so living in the community. But what about short-term solutions then to try to alleviate the strain that communities would go through, and especially businesses, to just try to survive?
So let me answer the question that you have not quite asked, but I understand the sentiment, and I've had to answer that question a couple of times. And it has its genesis in us closing a bridge. Our bridge has collapsed and we close it. And then somebody says, so where's the replacement? And I've explained ad nauseum that the decision process, the decision tree that leads to closing a bridge is an entirely different decision tree that deals with erecting a bridge. A bridge is closed for one and only one reason. It is dangerous and poses an imminent threat to life and limb. And to do otherwise than to close it, we would be guilty of criminal negligence, plain and simple. Does it mean that there is another bridge to be built? I don't know. Is there an alternate route? Maybe. Is the alternate route convenient? Maybe not. But one does not impact the other, because we do not have a defense that taxi carrying 10 school children to school, drop off the bridge collapse, the children die, and then I said, well, you know, I was concerned about the inconvenience of the alternate route. So we close bridges when they are dangerous. So that is one. How do we replace a bridge? What's the thought process that goes into replacing a bridge or constructing a bridge? Well, analytically, one, how many people use the bridge? What's the traffic count that goes over this bridge? Does it support any major industry, whether it's tourism, mining, or whatever? How many other bridges have been waiting to be built? Where in the queue does this bridge fall? Maybe it is the 99th bridge in the queue. Other people have been waiting. And then finally, what is the government's fiscal capability to actually finance it? So there are two different things. And I understand that if we could join the two and have a closure of a bridge and a precipitous reinstallation of the bridge, my life would be easy. But
we understand what you just expressed, but sometimes it makes life a little easier if there is communication, so people can be aware of where they are and what to expect, because outside of that it creates a vacuum and then people speculate. So we need to probably do better where communication is concerned, yes, so that there is less anxiety.
I accept that. If one of the deficiencies of us engineers is that we don't articulate our positions very well, so we concede that, and we will make that. We'll work hard to make that better.
One more question from PSWell. In respect of the special economic zones, the additional amounts being spent there, what would be the cause for that $200 million increase for the remainder of the budget year?
They have some administrative costs, day-to-day operational. They thought that they were underfunded before. So they have some contractual obligations, and so they did ask for additional funds. Actually, what they had asked for was permission to use the AIA, and so it went to finance, and the adjustment is being made here.
Member Hamilton?
One more question, PS. This is in relation to the traffic management and control arrears. Now, I see here a figure of 65 million. Just wanted to know the age of the arrears and whether this represents the total arrears or if this is a part of a larger figure.
Well, from what I recall, but I'll let Mr. Hunter respond that they used to get only $30 million per year, so 65 is very, very significant. But he could.
And what is the need?
Okay,
what is the actual need?
Okay, so it's that provision is to pay our liability to the JPSCO for the power that powers the traffic lights. There's some question you don't want to answer in public. That was the bill that was due, once so as to keep the systems going, we would try and borrow a little money from other areas to settle the bills as they come due. So we'll now we regularize the accounts now.
And we're up to date.
But it's not for the Minister of Finance to think that, well, we really don't need the money. Oh, yeah, we're up to date. We're up to date. We're up to date, yes. Yeah, we're up to date.
Okay. All right, on behalf of the members, I would like to say thanks to the Ministry of Economic Growth and Job Creation. Thank you, FS, and your able assistant from the Ministry of Finance. I know it has been a very long day for you. We, I believe, have concluded our business for today, and we're in a position to be able to pass the second supplementary estimate when we next meet Tuesday coming for the general sitting of Parliament. It was very critical for us to complete. Once again, I'll apologize on behalf of the opposition. The two members here, both the chair and Mr. Jackson, who was present, had a previous engagement that they were unable to break, but we decided to continue as the standing orders allow for another member present once we do have a quorum to continue the business of the government. So thank you again. Thanks, members. Have a wonderful rest of the day.
I'm standing in the heart of Jamaica. Spanning from Wakefield Trelawney in the north, as far as Catadupa, St. James in the west, to the Appleton Valley in St. Elizabeth in the south, and stretching to Norwood St. Anne in the east.